Hello, my name is Khadija Diggs, and I am an F2C sponsored triathlete where we are athlete-focused and science-driven. Today I'm here with Dr. Legenia Mitchell-Smith. She is a licensed doctor of podiatric medicine, and we're here to talk about some common foot injuries that triathletes receive. The top 10 items are blisters, Morton's neuroma, toenail contusions, extensor tendinitis, stress fractures, and plantar fasciitis, and I've actually suffered from 3 of the items on this list. Good morning.
Good morning.
All right, thank you for joining me today. So can you tell us a little bit about these injuries, what causes them, how to prevent them?
Okay, so the first one is the plantar fasciitis, which is commonly known as heel pain or heel spur, for example. Plantar fasciitis can be anywhere along the bottom of the foot, from the heel to the tips of the toes. So it can be in the ball of the foot or the heel portion, which is more common. It's usually related to foot type. So if you're severely flat or really high, it could be any of those. But for you, for example, you suffered from it, you actually have a more normal arch. So it could be just the common repetitive motion of over and over again of running. So when you have an inflammation of the plantar fasciitis, the most common thing we do is a steroid injection directly to the heel, which is the insertional point of the plantar fascia. So we do that, shoe gear modification, inserts into the shoes, anti-inflammatories, stretching, icing, all that stuff in order to help with decreasing that. Usually within 2 to 3 months of treatment, most people are completely fine with plantar fasciitis. As far as stress fractures are not as common, but again, it's more of a repetitive thing. The most common is the second metatarsal bone, which is the bone right next to the big toe, and it's behind the toe. Most people complain of pain underneath the second toe. On the very bottom is usually where they're complaining of pain. Okay. Sometimes it could be on top. Usually there'll be a lot of swelling on top that seems to never go away. They have pain with activity normally. X-rays are usually negative. Over time, if they continue the activity over and over again, I'll start to see changes on the X-ray. And if I do an MRI at that point, then the MRI will confirm a stress fracture. Untreated over time, it can then turn into a full-blown fracture. Treatment for that usually is rest, immobilization, using a boot, for example, is the most common for that.
And that's probably the hardest thing you can
yes.
tell an endurance athlete.
Yes, that is hard to stop. But with stress fractures, because we can't inject it, so that's really a very hard treatment is the stress fracture.
Okay.
Extensor tendinitis is also very common. That are the tendons on top of the foot. That pretty much is an inflammation of the tendons that go to the toes. So with that, again, we try to rest it if we can, wrap the foot, anti-inflammatories. We don't inject that area unless it's a pinpoint area. We try not to do the steroids by mouth because we know you guys have, you guys are tested and things of that sort. So we try not to do the steroids by mouth. So with that, anti-inflammatories, topical medicines do really well. Yeah. Also because there's not a lot of fat on the top of the foot. So if you're using pain creams on top, the penetration is very good. Also shoe gear modification too. Next one, toenail contusions. Again, very high up there on the list. You get a lot of blood underneath the toenails. For example, I always tell all my patients, cut the toenails. If you're a runner, cut the toenails, because the longer the toenails, the more it's going to hit the end of the shoe, the more likely you're going to have trauma. That's why they usually have podiatrists or something at a lot of these marathons, because if there's an immediate need, we go in there and we pretty much try to decrease the pressure to the area, allow all that fluid to come out, and then you can continue the race. As far as home care to it, usually it will come out on its own just by trimming the toenail. Morton's neuroma. This is another one that you suffer from.
One of my favorites, yes.
That is, we have nerves in between the toes.